Hi, I'm Judy Griffin with Aroma Health Texas. We're going to continue our mini-series on cancer care using essential oils. Keep in mind I said cancer care, not necessarily cancer cure. But we'll see, because essential oils do go past the blood-brain barrier, and so they have the capability of doing incredible amounts of healing of all types of illnesses. It's a matter of finding out the best ways to administer them. So, frankincense is what we're working on today, and it's been touted for millennia for healing properties, including cancers, and it especially is very beneficial for the skin. So a lot of these people who did get help in the past, it was very often the skin that they used frankincense on with cancers and different diseases. Frankincense has 90% is monoterpenes and sesquiterpenes, which are anti-cancer properties. And that is in all essential oils, most of them, but frankincense is really packed with these properties, and it makes it good for breast cancer, bladder cancer, cervix cancer, colorectal, and others that I've worked with, I'll tell you later on, but the research, those are the ones that it helps the most. The frankincense helps to increase the immunity and inhibits tumor growth, and it reduces the size of tumors and retards the signaling of metastasis, which most of its properties are anti-inflammatory, and that's how it starts. It can reduce edema in the brain, but a lot of the research, it didn't reduce the tumor that much. It can reduce breast cancer cell growth. It can reduce cancer-related fatigue. When we're talking about cancer care, we're talking about everything it takes to support the people going through it. It's very helpful in immunotherapy programs, and a lot of people are having chemotherapy, immunotherapy, or just immunotherapy, which is targeted to cancer cells. And frankincense is very supportive in helping immunotherapy. It also helps the people stay calm during the procedures. I had a really good friend, colleague, whose fiance got a certain type of cancer, and he was a physician, that it was very slow growing. I mean, he probably had 20 years, that's what they told him. And but he was so upset about the big C that he passed in 3 months. So keeping calm during all this and having people poke and prod and have to take all these different tests, it's very, very impressive to be able to help people in that way too. And you can count on frankincense to increase the white blood count, which is very important, especially in chemotherapy, because it's often the other things that cause somebody to pass from cancer. It's not always the cancer itself, like the white blood cells crashing or hemorrhaging. So frankincense can be beneficial in these things. It has some Boswelic acids, and I'll tell you, the nickname is AKBA. It means acetyl-11, keto, beta, Boswelic acid, and it's from the gum resin. and it's both in the serrata and the carteri. And some people say, well, which one is better? The serrata has about 20% of the AKBA. The carteri has up to 40%, between 35 and 40%. So it's actually, the carteri is essentially more healing. And if that makes, a difference in which one you prefer to buy. One thing that a 2013 study in Leicester, England, showed that the AKBA was more effective than chemotherapy in finding hiding cancer cells. And this was at any stage, beginning to end. And some of the cancers like ovarian that are hard to treat, then it was very good helping to diagnose and treat those cancers. The sooner you get it, the better it's going to be. So, frankincense can also be used to overcome resistance to chemotherapy. It helps the survival rate, and believe me, 45 years, a lot in hospitals. One hospital in Dallas, it was 20 years, and so we could really see the survival rate make a big difference with essential oils, with frankincense, the different ones that I used. There's other things I thought you might be interested in with the Boswelic acid, and that is it reduces the breast density. The breast can become so dense that it's difficult in mammography to be effective in finding possible cancers. So that's one thing that frankincense does. And in blood tests, it's called liquid biopsies. Medical can now locate cancers as tiny as a pinhead and analyze the DNA by analyzing the DNA from the cancer cells in your blood. So it can be picked up very quickly, and if it reoccurs, it can be found very quickly. Boswellia, which is frankincense, interferes with cytokine production. It damages, by doing this, it damages the DNA and tumor growth. It sounds like it should be able to heal just about any cancer. Well, it's definitely a helper, okay? I can't make those claims because in the 45 years I was working with cancer patients, most of them still needed something else, chemo, radiation, immunotherapy, whatever worked for them. So what this AKBA, which are the boswellic acids, promote is cell death in cancer cells. And this also helps to support radiation. So when people have radiation therapy, and remember, frankincense is good for the skin. It's beautifying for the skin. So it helps people who have radiation to be able to not have any problems with their skin from it. When I work with cancer patients with frankincense, the list was longer than the one I gave you up front. That was research. I worked with them with bladder, brain, breast, cervical, colorectal, glioblastoma, which is a brain cancer, and head and neck cancer, liver cancer, lung cancer, pancreatic cancer, prostate cancer, and certain types of leukemias. There's many types. There's chronic and there's acute leukemias. It inhibits cancer growth and cell death, and that's how it helps certain leukemias. And remember, just by reducing the inflammation, it's making a difference in the tumor growth and stopping it. It interferes with the DNA. We talked about that. So the tumor growth cell death, and it's anti-inflammatory. Those are the things you need to remember about frankincense. And most people are willing to try it with most any type of cancer, and if any one essential oil is going to be able to help many, many different types of cancer symptoms and problems, then frankincense would be it. Your caution would be blood thinners. Boswellia also thins the blood. So one thing you have to be careful of in cancers is hemorrhaging, and that's internal bleeding. So if the person is on blood thinners, do not use the Boswellia without permission of the medical people in charge, or health practitioners of whatever type. There can be side effects. Now, we're not ingesting frankincense, we are wearing it. And that's what, so far, the research has found is to be the best, and what I've always used is topical application, because the skin is an immune organ itself. So frankincense for some people can cause nausea, diarrhea, abdominal pain. It can also inhibit neuropathy by being anti-inflammatory, so that part kind of balances that out. And you want to do a patch test. You always have the person smell it, just a little whiff, to make sure they're not taken back by it. But you want to do a patch test before you put anything on your skin, especially cancer patients. So the inner arm would be a good place, and we'd use anywhere from 15 to 20, 25 drops of frankincense in a carrier oil, like the ones we've talked about before. Or if you just have a tablespoon of carrier oil, you could use 3 to 5 drops of your frankincense. Now, always you'll get this one person who's going to call you in the middle of the night because they put frankincense in a carrier oil all over their face, and now their nose looks like a red light, instead of trying to patch on their inner arm, because it's natural. Well, it is natural, but you can have a reaction to it. It's rare, but it happens. And with cancer patients, you know, their immune system is under attack in a way, so we want to be really careful with that. Again, I mentioned this last time, if they are taking chemo, and sometimes it's so many days off and then 2 or 3 weeks off, just the opposite. So many days on, a couple weeks off. It's those couple weeks off you want to come in with your essential oil therapy, and that's the best time to use it. With radiation, you know, you really have to ask the radiologist, but very often, because it's like almost every day, very often they'll let you use the essential oil blends on the off days of radiation, or they want you to wait until you finish. Whatever, you know, radiation keeps working even after the person finishes their protocol. So I hope you like, subscribe, and share. I hope you get in touch with me, ask me questions, examples, whatever you want. And we're going to be back next week with yet another essential oil used in cancer care. Thank you for coming and being my teachers. Bye.